So welcome to the McMaster Midwifery Research Center Speaker Series, a series of regularly scheduled rounds that are open to everyone to share the latest midwifery-related obstetrical and perinatal research. My name is Dr. Ginny Brunton. My pronouns are she and her, and I'm one of the scientists of the MMRC. Please ensure that your Zoom mics are turned off today, and note that today's presentation will be recorded and made available on our website soon. So I'd like to start off this session in a good way. On this day, I'm coming to you from the traditional unceded territory of the Mississaugas of Scugog Island First Nation in Ontario. I feel a deep sense of gratitude for the Indigenous stewards of this land. As a settler, I'm mindful of my responsibilities to live in harmony with the original peoples of Turtle Island and with the land. Beyond my gratitude, I'm also committed to actively listening, learning, and unlearning the narratives that have shaped my understanding of this land and its peoples as a step towards truth and reconciliation and the ongoing process of decolonization. McMaster University itself in Hamilton is located on the territories of the Mississauga and Haudenosaunee nations, with the lands protected by the Dish with One Spoon Wampum Agreement. So I'm pleased to introduce our speaker for today, Allison Campbell. Allison has an MA in sociology. She's a registered midwife and is an associate professor of teaching in the Midwifery Program, the Midwifery Undergraduate Program Lead at the University of British Columbia. Allison's currently completing PhD studies in the Institute for Gender, Race, Sexuality and Social Justice, otherwise known as the Social Justice Institute at UBC. Combining her professional and political interests, which are social justice and perinatal healthcare and incarceration practices in Canada, and informed by many years learning, practicing, and teaching midwifery, Allison's PhD work focuses on perinatal experiences and reproductive justice in prisons in BC, specifically with regards to parenting behind bars. Allison has received funding from SSHRC and the UBC Public Scholars Initiative for her research, and is a 2023-24 recipient of a Killam Teaching Prize. Allison's talk today is entitled Parenting Behind Bars, Maternal-Child Connection and Separation in BC's Correctional Facilities Designated for Women. And she will be discussing a proposed research project regarding the historical and current use of the Mother-Child program in prisons designated for women in BC. The use of mother-child programs or other alternatives will be discussed using the intersecting frameworks of reproductive justice and prison abolition. So welcome, Allison.
All right. Well, everyone, thank you for having me here today. I'm really excited about this talk. It's such a great opportunity to talk to you about my PhD research, my work that is very much in progress. I'm grateful that you're here, and let's get started. I am joining you today from the shared ancestral territories of the Musqueam, Tsleil-Waututh, and Squamish communities in British Columbia, where 95% of the land in this province has never been ceded or legally signed away, including the land on which the city of Vancouver currently sits. So, in other words, we always say that we are on unceded ancestral territories of the Squamish, Musqueam, and Tsleil-Waututh communities. Today, I'm going to be talking about issues relating to the criminal legal system in Canada, which is just one of the more egregious examples of colonizing forces which are still operating in Canadian society. Indigenous and racialized women are vastly overrepresented in Canada's prisons. Some of you may know that. In 2020, for example, 42% of the individuals who are being held in federal prisons identified as Indigenous. 42%, despite making up only 4% of the general population of the country. The federal incarceration rate of Indigenous women is up to 12.5 times higher than that of non-Indigenous women. In provincial jails, it's even worse, where the Indigenous population averages 40% across the country, but in some provinces can be as high as 90%. 90% of some provincial prison populations are Indigenous folks. Indigenous women and girls tend to directly encounter the criminal legal system from younger ages, serve more and longer sentences, and have higher security classifications than non-Indigenous women and girls. These factors have compounding impacts on their reproductive lives, spending more of their reproductive lives behind bars, introducing more barriers to maintaining relationships with their children, and having longer-term effects on their general and reproductive health. There's many reasons for all of this, all of which are traceable to the entrenchment of poverty, generations of disenfranchisement, and the devastating and generational impacts of residential schools, the 60s and the 60s scoop, systems which were put in place as tools of colonization and which continue now through the over-incarceration of Indigenous women and girls, boys and men. So when I acknowledge land-based connections when doing this work, I do so remembering that colonization is a very active process and is still very actively being enacted through many of our social systems and institutions in Canada today. As you heard, my name is Allison Campbell. I'm a registered midwife of almost 20 years now and an associate professor of teaching at UBC, where I'm the undergraduate program lead for midwifery here. These days, I'm also a doctoral student in the Institute for Studies in Gender, Race, Sexuality, and Social Justice at UBC, also known as the Social Justice Institute. It's a bit of a mouthful. I'm in my third year in that program, and I'm about to begin my research. So just to say that I'm just ready to submit my proposal and hoping to start my data collection this summer. So this presentation today is really about telling you about my research and sort of map out for you why it's important and what I plan to do about it. I won't be giving you a lot of data today because I haven't yet collected it. I hope it's interesting anyway, though. As midwives, midwifery students, and midwifery researchers, we all know having a baby can change people's lives. I mean, not every time, right? But I imagine that everyone in this room today has at some point been witness to the transformative potential that having a baby can have on people. It's an exciting time, one where people make new plans, start new chapters in their lives, and begin new futures for themselves and for their families. This is true for many people, but for women who find themselves pregnant while facing a period of incarceration, the picture, as you can imagine, can be quite different. For women in this situation, a pregnancy can be an exceptionally challenging and stressful event, especially if it means that their baby will be born before their sentence is completed. Because what will happen to their baby? How will they bond with them? What about breast or chest feeding? Will they get to see them again, or will they be lost into the foster care system? These are just some of the questions women who find themselves pregnant behind bars face. My study is an investigation into the maternal-child relationships in prisons designated for women in Canada. Specifically, I'll be looking into the mother-child program at Alouette Correctional Centre for Women in BC, which is the only residential, like residential in a prison, parenting program at the provincial level across the country. The study aims to understand the experiences among individuals parenting young children during a period of incarceration in BC, within an examination of the policies, practices, and institutional discourse regarding the utilization and effectiveness of the mother-child program. Essentially, I'll be looking to understand what people's experiences of parenting has been, understanding that there is a mother-child program at Alouette Correctional Centre for Women. The goal is to understand what people's experiences reveal about the way state power operates in carceral settings. And I will talk a little bit more about this later on when I get to my theoretical framework. So don't worry too much about that now. For today, I would like to give you some background on why this research is important. So I'll start by providing a snapshot of the target population of my study, the people who are experiencing incarceration in Canada's prisons designated for women. I'll talk very briefly about international human rights documents, which uphold the fact that women and gender diverse people who are incarcerated do have reproductive rights that need to be attended to. And I will provide some brief historical and political context of the Mother-Child program in BC because it's so interesting and it's really very relevant. The history of it is very relevant for my research. So that's just the background piece. And then I will talk briefly about the overlapping theoretical orientations that inform my work, which are, spoiler, are reproductive justice, prison abolition, and necropolitics, biopower and necropolitics. And that's the piece that gets into talking about like state power and the way that states organize people's lived experience. Again, I'll get more, come back to that later. And then I'll just want to tell you about how I plan to approach this study. There are 3 phases of data collection, and I'll talk to you about those. And finally, I'll talk about what I hope will be the anticipated impacts of this work. And then we'll open it up for questions. So I don't think that I'll talk more than half an hour or 40 minutes at the most. I hope there will be some time for questions. Oh, also, I was going to say that I decided not to do a deep dive into any literature review today, but I'm very happy to answer questions about that. If you're interested to know like what kinds of research have already been done in the field, I can always answer questions about that. Before I get really into it though, I do need to make a note about language use. You'll hear me using terms like women and mothers quite a lot. I by no means intend to infer that all women who are parenting identify as mothers or that all mothers identify as women. These are shortcuts and they speak to the majority of the individuals that I'm referring to, but by no means, I in no means intend to be exclusive of gender diverse people by using these terms. I do try to interchange these with the phrase women and gender diverse people as much as I possibly can without it being too cumbersome. And in that vein, you'll notice me using a very long phrase over and over again, which is prisons designated for women, as opposed to talking about women's prisons. And really that is very intentionally to be gender inclusive, recognizing that gender diverse people are also held in prisons designated for women. So corrections, as with many government organizations, the language is very, very binaristic. They talk about women's prisons and men's prisons, and that's it. So this is, and then certainly historically, there's only women prisoners and men prisoners. Well, women prisoners and prisoners. But I really am trying to disrupt that language, and the best phrase I can come up with that is also reflected in the literature is prisons designated for women. Ultimately in prison work, we always try to use person first language, noting that people, noting that people are people who are experiencing incarceration. So we don't talk about prisoners. I don't refer to people as prisoners or as incarcerated people. They're people first, so I will always say people who are experiencing incarceration or individuals. So it can be cumbersome, but it's important. And then secondly, just for your knowledge, it's important to know that there are 2 systems of incarceration in the Canadian criminal legal system. The federal system is where people serve sentences of 2 years or more, and provincial is sentences of up to 2 years less a day. Sentences are roughly correlated to the severity of the offense, but sometimes other factors are taken into account, like offending history and perceived risk to the public. It gets complicated with sentencing, but for the most part, what you need to know is the difference in sentence length. There are 6 federal prisons designated for women across the country, and they generally have a lot more programs and resources than provincial prisons do. That's federal. Each province has prisons designated for women, although in some provinces, these are just women's units, which are co-located in men's prisons. So there would be like a unit in a prison that's built for and housed by men. And there was one separate unit on there where the women stay, women and gender diverse folks stay. At any rate, for my study, I'm focusing at the provincial level. in BC specifically, where we have a standalone prison designated for women. Whoop. And here it is. This is a view from the other side of the fence of Alouette Correctional Center for Women. So now is when I tell you the sad fact that women are the fastest growing portion of the prison population in Canada. Today, women make up about 10% of all people held in BC's provincial prisons. Most of the time they're in jail for nonviolent, property, and drug-related crimes at the provincial level. And they tend to commit, women and gender diverse folks tend to commit the same crimes over and over again. Unlike men, their crimes don't tend to escalate over time. Of course, there are exceptions, but this is general trends I'm talking about. So shoplifting, possession of drugs, and communicating for the purposes of selling sex in public. That's mainly what it is. If women do commit a violent offense, it's usually against someone known to them, an acquaintance or a spouse, and most often in self-defense. And the other important thing to know is that the vast majority of people who are held at Alouette Correctional Center for Women, 3/4 of the people who are held there are actually there on remand, which means that they either haven't had their trial yet, or they're awaiting sentencing. So only 1/4 of the people at Alouette Correctional Center are actually there with a provincial, like a really designated provincial sentence. In BC, we have, like I said, Alouette Correctional Center. It is an 188-bed facility. And the average length of stay in 2023 was 45 days. So although sentences can be up to 2 years, often they're just in for a very short time, like up to about 45 days and then back out again. I want you to know that the photographs that I have on here are all from publicly available photographs online. I didn't take this photograph, but it is from a documentary about incarcerated women who were incarcerated and their children. So it is publicly available, and the people in the photographs would have had to have already given consent for their use. Statistics on parental status are not publicly available. So we don't actually know for sure how many women and gender diverse people in prisons designated for women are mothers. However, 71% in 2023, 71% were of childbearing age, meaning between the ages of 18 and 35. We think generally the stat that's thrown around is people think that up to 80% of women going to jail in Canada are the primary caregivers to children on admission to prison. So really, they are of childbearing age and they have kids. And if they don't already have kids, they will sometime soon, very likely. So not surprisingly then, women who are incarcerated report relationships with children as the #1 concern that they face. But we don't have an accurate picture of what happens to the children when a mother gets sent to jail, although we do assume some are cared for by family members and many are relinquished into the foster care system. And no one has tracked what happens to those relationships when mothers get out of prison, which most of them do, right? They're especially provincial, they just come in for a short time and they're back out again. But nobody keeps any data on the kids, whether they exist in the first place, and never mind what happens to them once somebody comes into jail. Now, I'm just going to talk briefly about this. There are 3 international documents which together set out a baseline of appropriate treatment for individuals who are incarcerated in prisons designated for women. They are these 3. The United Nations Standard of Minimum Rules for the Treatment of Prisoners, aka the Mandela Rules, which actually was written in 1955 and updated in 2015. The Kyiv Declaration in 2009, and then the Bangkok Rules in 2011. So these are UN documents that talk about the treatment of prisoners. There's many specific references to reproductive rights in these documents. Most importantly for this study, the Kyiv Declaration recognizes incarcerated women as a population with unique health needs that require gender-specific healthcare. And the Bangkok rules state that women are entitled to gender-specific incarceration practices, which address their unique needs, identifying the extremely negative impacts that incarceration has on both women and their children. These are important documents because, you know, they set international standards. And so I think it's really important to remember whenever we hear about or are tempted to think about Canada as, you know, a leader in upholding international human rights standards, that this isn't always the case. Despite these repeated international declarations, reproductive health and parenting needs continue to be neglected. The reproductive health needs of women in Canadian prisons are understudied. Existing studies tend to focus at the federal level, and very few focus on individuals' experiences. They're mainly outcome focused, like, you know, access to prenatal care, how many prenatal visits people are getting, or incidence of preterm birth, or, you know, perinatal outcomes kind of focus. Very few are actually based on people's individual experiences. Okay, I want to now move to give you a bit of background and history about the mother-child unit in BC. In federal prisons where individuals serve sentences of 2 years or more, the mother-child program there is a mother-child program in the federal system at all 6 of the federal prisons. It allows eligible individuals to have their children reside with them full-time up to the age of 4 and part-time up to age 6, whether or not they're born while their mother is in custody. So if a woman in the federal system has a child under the age of 4 and they're eligible for the program, they can ostensibly have their kid come in and stay with them for, I think they go in for 2 weeks and come out for a week and go in for 2 weeks or something to that effect. Among provincial correctional systems across Canada, BC is the only province to have a similar program. So no other province in Canada has a mother-child unit or program. BC has a long history of having a residential parenting program available for women who gave birth while serving provincial sentences. This is so, again, the difference here is that it's only available for people if they were pregnant when they came in and gave birth while they were in custody. This goes back to 1973 at the Twin Maples Correctional Center. And then it continued on when Twin Maples was shut down and BC Correctional Center for Women opened in 1991. The program continued at BCCW. That carried on until 2004 when BCCW was shut down. Actually, it was turned into a youth detention center. And they opened another facility called Alouette, and that was in 2004. Eligibility has always been restricted to those who had very low security classification, who were low risk to reoffend and low risk to the public. These programs reflected a general approach that recognized women were typically primary caregivers for their children, that the reasons for their incarceration did not necessarily reflect on their ability to care for their children, and that given that women would ultimately return to the community, a maintenance of the maternal-child relationship was in the interest of both parties. About 100 mother-baby dyads were enrolled in the program from 1973 up to 2008. So in exactly my lifetime, being born in 1973, for those, what is that, 30-something years, 35 years, there was about 100 mother-baby dyads enrolled in the program until 2008. By all accounts, the program was considered a successful attempt to achieve the goal of maintaining family connection for incarcerated mothers. Staff and other women in custody were generally supportive of the program. That having babies on site had a calming and positive effect on the environment of the institution, and everyone generally rallied to make sure that they were safe and cared for. These are the reports that we have heard about that are documented about the program. There was even a daycare center on site at BCCW for a number of years that allowed women to see and spend time with their kids during the day, even if they couldn't stay on site. They could come and be a part of the daycare program. And staff also brought their kids to the daycare program. But despite its success, the mother-baby program was unceremoniously canceled in 2008. No notice was given, there was no evaluation, there was no reason given. It was seemingly at the whim of one upper-level BC Corrections administrator. Like literally an email was sent that said, we'll no longer be running this program as of February 1st. The last baby was accepted into ACCW in January 2008 and left in February. Later that year, and this is important, 2 women filed a complaint to the BC Supreme Court, arguing that the decision to cancel the mother-baby program compromised their infants' well-being and women's and infants' constitutional human rights. From 2008 to 2014, 23 babies were born to women serving time at ACCW. In the absence of a mother-baby program, all the infants were taken into the foster care system, and no follow-up data is available for these families. Things take a long time in the legal system, so it wasn't until 2014 that the decision came down about this case, and it's called the Ingalls decision. And it's very, very important for this work. In 2014, the BC Supreme Court ruled that the closure of the mother-baby program did compromise the human rights of both women and their babies. I don't know why I always get choked up when I talk about it. It stated that access to a mother for the purposes of breastfeeding and bonding, when there is no overt risk of harm to the child, is every infant's human right. I guess this is the midwife coming out. Even if the mother happened to be in prison at the time. So this was a monumental finding because it gave legal recognition of maternal-child relationships, even in carceral settings, right? And it validated the concern that most people expressed, that was most expressed by individuals in prison designated for women. Second, it found that closing the mother-baby program amounted to denying both mothers and infants access to each other on the presumption of harm, meaning like somebody decided that it wasn't safe for babies and moms to be together in a prison without any evidence to support that, finding this to be contrary to the principle of the best interests of the child. The court not only maintained that the best interest of the child was in fact a relevant concept in the decision to cancel the program, it foregrounded the health and psychosocial benefits of keeping mothers and babies together, making it clear that guaranteeing the safety of infants was an impossible standard to meet, and in the absence of evidence of harm to infants enrolled in the program, the court reinforced that canceling the mother-baby program introduced additional risks to the infants by denying them access to their mothers for these purposes. Most importantly, it also exposed those infants to potential risks by placing them in the community, where evidence has showed between 2008 to 2014 that they would inevitably end up in foster care. Most of them would. Most significantly, BC Corrections was given 6 months to reopen the mother-baby program. And it did that. BC Corrections spent, this is a terrible photo. It's the only photo online that I can find about the mother-baby program that currently exists. And it is just from their press release from the day that the unit opened. This is the warden at the time, showing off like the kid furniture and stuff. BC Corrections spent almost $250,000 to refurbish the mother-baby unit at Alouette. It was a specialized open living unit which could hold up to 9 mother-baby pairs. So there is a program there. It started again in 2014. There's a special unit there that's separate from the rest of the from the rest of the place. It's not very separate. It's on the same grounds, but it's like its own standalone unit, and it can hold up to 9 mother-baby pairs. So ostensibly, they could have up to 9 babies there at a time. Do you think that they do? In fact, in the past 10 years, since 2014, very little information is publicly available about the BC Mother-Child program. They're now calling it Mother-Child program. So it goes back and forth in the language, whether it's mother-baby or mother-child. No information is available about it. Neither its overall effectiveness, utilization or outcome data, nor its relevance and safety for Indigenous or other racialized individuals. To date, there has been no research-driven evidence of impact, utilization analysis, nor program evaluation of the mother-baby program in BC, and nor have institutional barriers to its utilization been studied. And most concerning, community advocates report that the mother-child unit has barely, if ever, been used since 2014. Although the program exists on paper, community advocates report that no one is actually being enrolled in it. Women are not being told about the program, or they aren't eligible for it. It's hard to know what's actually happening because, again, no data or information is readily available. As I said, this is the only photo I can find that has any reference to the program at all. And 10 years after the human rights decision came down, the program has still never had a formal evaluation. So we can't actually say if it's a good thing or not, if it works or if it doesn't. In the absence of any data, what my question is, what are decisions about access to the program being based on? And I want to find out what's going on here. All right, that's all the background. We're going to shift now just to talking a little bit about what my study is going to look like, and then we'll have time for questions. So this gets a bit heady, so I'm just going to touch on a few things, and you can ask me questions in the Q&A if you have more, if you want me to go on more about it. Essentially, there are 3 overlapping theoretical orientations with which I am approaching this work: reproductive justice, prison abolition, and which are both theoretical frameworks and calls to action, both of those things. But my approach to this study is really informed by an analysis of biopower and necropolitics, with prisons being seen as a necropolitical tool for ensuring that some people in society are made to live and others are made to let die. And I will talk a little bit more about that in a minute. So reproductive justice, I hope that many of you have been introduced to this framework by now. But in case you haven't, a very brief synopsis, which only scrapes the surface. Reproductive justice is a framework that came out of the reproductive rights movement in the US in the early 1990s. It was developed by a group of women of color called the Sister Song. They called themselves the Sister Song Collective, and they were feminists, activists working in the abortion rights movement, and became really frustrated with how white dominated and white centric that movement was, and how binaristic, the movement was organized around a binaristic notion of choice. Either you choose or you don't choose. And people became really frustrated with that and argued that we needed to have a broader and more nuanced understanding of this notion of choice. Because, of course, people make choices within a social context that they are in, social and political and economic context. So reproductive justice examines the meanings assigned to reproductive relations and externally imposed policies and practices, and it's much broader. It's an intersectional framework. It talks about relationality, power, social inequality, social context, and complexity and social justice. Oops. Oh, I'm missing a slide. Oops, okay. There are 3 principles to reproductive justice, right? One is the argument is that every person has the right to choose to not have a baby. The second is that everyone should have the right to choose to have a baby if that's what they wish to have. So the right to not have children, the right to have children. And thirdly, that people should have the right to raise the children that they do have in safe and supported communities. And that's the piece that for me makes reproductive justice incredibly essential to this work. That people ought to have the right. I say ought to because I don't think we can actually argue that people do have that right. Like that right can be taken away from people, as we can see with this work. But that people ought to have the right to raise their children in safe and supported communities. I mean, just imagine for a moment, I invite you to imagine for a moment, if we lived in a world where people actually had that right and could exercise it. It would be a very different world that we would be living in, especially these days. So those three principles, right? And reproductive justice is a theory, it's a theoretical framework, it is also a call to action, and it is a social justice movement. Similarly, reproductive justice finds its allies in prison abolition. Like reproductive justice, prison abolition is a theory, framework, and social justice praxis, founded and led by feminists of color in the US in the late 1990s. I was at this conference, actually, the Critical Resistance Conference in 1998. Who knew? I did not know at the time, like what a movement building experience that would be and what a pivotal experience in my own life. Prison abolition considers state violence to be essential to how the state operates. Drawing on the work of W.E.B. Du Bois, the theoretical framework informing prison abolition maintains that mass incarceration cannot be addressed without an analysis of the impact of interlocking systems of oppression, specifically global capitalism. For me, prison abolition and reproductive justice are interwoven calls to action. Closely related to prison abolition and kind of overarching all of my thinking are Foucault and Mbembe's concepts of biopower and necropolitics. I won't go into it too deeply here, but in short, biopower is a technology, comes from Foucault, who argued that biopower is a technology of state power that emerged in the mid-18th century and is characterized as the function of the state to make live and let die. At this time, states represented their ruling strategies as creating the conditions of life for the population, while those who did not live, literally or figuratively, were responsible for their own demise. In other words, the state is responsible when people are thriving, and not responsible when people are not thriving. In other words, it's their own fault. Foucault's account of the emergence of biopolitical state regimes showed that one of its main aspects was to organize a distinction between who is part of the population and who is not. Institutions such as schools, the military, prisons, and medical institutions, which allowed the state to monitor and support the health of the population, were at the same time technologies of control and discipline. Akhil Mbembe, in his essay titled Necropolitics 2003, excellent essay, I encourage everyone to read it, built on Foucault's theory of biopower, drawing specific attention to the social and political processes which determine who is left to die. Necropolitics are the technologies of power which subject entire populations to contemporary forms of subjugation of life, to the power of death. Necropolitical strategies work in tandem with biopolitical strategies to differentiate the morally deserving subject from those who are undeserving. So there's this hierarchy of deservingness that happens that is very intentional. I begin from the starting point that prisons are a necropolitical strategy intended to create and reinforce a hierarchy of belonging among the population as a whole. That they are used by the state to remind people of that hierarchy, establishing by their very existence a hierarchy of deservingness of care. We only need to reflect on the egregiously disproportionate percentage of Indigenous individuals who are incarcerated compared to their portion of the population of Canada to understand this. I'm aware that time is marching. So in short, this is a qualitative study using institutional ethnography as its method. Institutional ethnography was developed by Dorothy Smith in the mid-80s. It is known as a sociology for women in that it takes up as its starting point the experiences and the lives of people who exist outside of the relations of ruling. So if you consider that the relations of ruling are like the way that society is organized around the people with the most power, then whoever is outside of the apparatus of power, their experiences should be the starting point of any institutional ethnography. The object of study is the relations of ruling themselves. So you look outside of the relations of ruling you start there in order to understand what's going on, what is happening, how states operate is really the question. So institutional ethnography has been characterized as a method of looking up into the workings of social institutions from outside or below them. The goal being to understand how things came to be the way things are down here. So it's not so much only looking at like what is happening. What is happening is the starting point. It is the subject. And the object is to understand how it happened. So how people's experiences are organized by ruling relations. That's all I'm going to say about that. I guess for this study, the ultimate goal is to investigate what people's experiences reveal about the way that state power operates. So what people's experiences of, well, here are the research questions. So what do individuals' experiences of parenting young children during a period of incarceration in BC from 2014 to 2024 when the Mother-Child program has existed but isn't being used? What do those experiences reveal about the way the state power operates with regards to parenting in prisons? That's my overarching question. And then there are 3 smaller questions that are tied to the methods. So I'll just go on to that now. There are 3 phases of data collection for my project. The first one is probably the one I'm most excited about is really to try to understand what those experiences are. So what are individuals' experiences of parenting young children from 2014 to 2024? It will be a photo elicitation project. I'm hoping to interview and work with up to 20 people who were incarcerated during those years who had young children at the time. And I just want to understand what their experiences of parenting were during that time. Photo elicitation is a method where people are given prompts and they are asked to go and take photos according to some prompts, which will be, in my case, very loose. I just want to, ask them to solicit. I'm just asking them to take photos that solicit the experience, somehow speak to their experiences. And then we'll use the photos in the interview to talk about what those experiences were. The thought being that photographs sometimes can help be like a portal to deeper understanding of what's going on. That's phase 1. So that will gather the data of like what actually those experiences are. And then phase 2 is interviews with key informants. These will be corrections staff, policymakers, also community advocates, people who are not themselves impacted by by what's going on, but who are involved in it. And for here, my questions are really, it's just interviews, and I'll be asking to find out what are the facilitators and barriers from their perspectives to the operation of a mother-baby program. And then finally, through all these conversations, it's likely that there will be reference to some texts. Texts are really important in institutional ethnography because they are seen as sites of ruling. So, the ruling apparatus kind of like navigates itself through texts, whether that's policies, procedures, forms, whatever it is. So I need to look at what the texts are and have a look and see what they say and how they are operationalized. Oh, I was so slide weary by this point. I ran out of steam to make a slide. So I'm going to skip my analysis because I think I've talked about it enough. And I'll just go to say that I anticipate, these are my hoped for and anticipated impacts of this study. I anticipate that it will generate really important information about the experiences of people who have babies while they're incarcerated and what happens to their children after birth. As the first study focused on the Provincial Mother-Baby Program in BC, it will generate evidence to guide a proper evaluation of the program, as well as a comparative analysis with other programs like it, either with the federal system or similar programs in other jurisdictions, creating a real opportunity for reflection on incarceration practices for women in this province and in this country. This study will also contribute knowledge regarding governance and power relations and ruling relations in carceral settings, which is, of course, its main goal. That's what I'm excited about is that there is this broader goal about contributing to sort of knowledge of ruling relations very generally, but there's also these very tangible goals that will really directly impact, hopefully, the way that we understand carceral institutions in Canada. And that's it. That's all I had to say. So this is me, and this is my email address if you want to get in touch with me. And I think we have 8 minutes, Ginny.
Yeah, it looks like about 8 minutes.
So sorry for going over, but I wonder if anyone has any questions.
Yes, please. Feel free to raise your hands, or you can pop a question into the chat as well. Gosh, Allison, thank you so much for that presentation. It's really powerful demonstration of maternity care needs related to vulnerable populations, so vulnerable.
Yeah.
So I'm glad you're doing this work, and I'm excited that you're taking this social justice angle. I know that's a big part of your work. And I'm just really glad to see it enacted in this way, that, hopefully some change or some light can be shed on what's going on here.
Thanks, Jenny.
Yeah.
The truth, it is true, this is where I live and breathe, but it's also not necessary to, right? Like, it is still very, like, people who are pregnant and having babies and postpartum, even in the few months postpartum going into jail, they still need care, and they need good care that is trauma informed and community based and individualized, which is really obviously very well aligned with the midwifery model. So while I come at it with like a real whole, like big picture social justice kind of angle, it's not necessary. We can also just look at it as like, this is a population of people we ought to be caring for.
Yeah, absolutely.
Hi, Amy. Amy from
Hi.
BC. How you doing?
I'm doing good. I'm so grateful for this presentation, and I guess this isn't a question, but like something that was baffling to me, that has been no research about this yet. I'm sort of baffled, but sort of not. And so basically what I'm getting and understanding is there's no research because no one really cares. And
Yeah.
so your project, I get tears too, and I'm not surprised you have tears because you're putting care into something that's so obviously needed. And how easy to like close a program, start it up, not operate it when you don't have any evaluation of it. So there's no proof if it's bad, there's no proof if it's good. So I'm
You're
super
not even collecting data. This is it,
like
right?
it's
They don't even
ridiculous.
collect data. They don't
Yeah.
even collect data on how many people who they're caring for have children.
Yeah. It's
You'd
shocking.
think this would be important, but if you're not collecting data, then you don't have to look at it, right?
Yeah.
So which is really important for all of us to realize, because of course what's happening in the States right now is they're not even taking any data. Do you know that in some states they're not even keeping, it's illegal now to keep data on maternal deaths? In Texas, in Georgia, it's like you cannot keep data on maternal deaths. So if you don't keep the data, if you're not tracking the data, then you are not looking at the problem. You just don't even see it. It's not a problem because you're not even looking at it, right? You're making it invisible. So this is what I mean sorry to cut you off, Amy. I cut you right off. But
No, I'm excited. It's so good.
My perspective on it is that these are very intentional processes. It is very intentional that Corrections BC and Corrections Canada does not keep this data, because They don't want to know, right? It's not their purview. They just are there to execute the sentence.
Allison, there was a question in the chat asking for the article again that you recommended with when you had the slide about necropolitics and biopower.
It's just simply called Necropolitics, published
Yeah.
in 2003 by Achille, Achille Mbembe, Mbembe.
And was that the article that you recommended everybody should read?
Oh, was that it? Yes, that was it.
Okay, thank you.
Yeah.
Thank you. Just wanted to clear that up. And I don't see any other questions. Rash, how are we doing for time?
We've got 2 more minutes if anyone has any other further questions. Otherwise, Jenny, take it away.
Okay. Okay, so thanks again, Allison, for presenting your work to our MMRC audience today. Very powerful presentation. Please do join us next Wednesday, March 26th at 12:30 Eastern Standard Time, when Abigail Corbin will be sharing her research on perinatal mental health needs assessment, a partnership between the Eastern York Region and North Durham, Ontario Health Team, Oak Valley Health, and the McMaster Midwifery Research Centre. And there's a little a slide about it there. You can get more information on our speakers and schedule, which is going on all year, and watch recordings of previous presentations on our website at www.mmrc.mcmaster.ca. And I think there's a podcast to share with you. We have a really great podcast series called Conversations on Midwifery, Experiences, Education, and Evidence, CME3, to help you stay up to date on the latest evidence-based practices and shine a light on innovative approaches in the field, and most importantly, provide a platform to share the common experiences that make midwifery unique. You can find that podcast on Spotify, Acast, and Music, and we'll post a link for that in the chat. And finally, don't forget to save May the 20th for the annual MMRC Midwifery Research Symposium. You can register now using the link in the chat. We've got a great series planned, and we hope that you can join us for that. So thank you again, Allison, and thank you all for joining us today. Hope you have a great day, and we'll see you again in March.